For millions of people, treatment-resistant depression is this lifelong, exhausting battle with an illness that just refuses to quit. But what if a revolutionary new therapy could actually bring someone to full remission in just 5 days? Okay, let's get into it. We're going to break down the science behind a truly radical new approach that might just rewrite the entire rulebook for treating severe depression. To really get why this is such a huge deal, you first have to understand the sheer frustration involved. This quote from a patient, Tommy Van Brocklen, it just cuts right to the heart of the stigma and the quiet struggles so many people face when the usual treatments just fail them. Because this isn't just some clinical term on a chart, right? It's a feeling. And this incredible sculpture, it's called melancholy. It captures that sense of profound emptiness, that weight, perfectly. It's a really powerful way to visualize the emotional state we're about to explore and the desperate need for a new kind of hope. So, to really grasp the impact of this new therapy, we have to look at the human story behind the science. And it's a story about one man's incredible 45-year search for relief. This is Tommy Van Brocklen. His struggle started all the way back in 1975, when he was just 15 years old. And for decades, decades, he tried everything. Talk therapy? It helped, but the relief would only last for about half a day. Medications like Paxil seemed like a miracle at first. They worked for years, and then one day, they just stopped. Nothing else they tried worked, and one drug actually made him suicidal. Imagine that. After 45 years, he felt like he was completely out of options. And just to put that kind of suffering into perspective, public health experts have a way to measure the burden of different illnesses. We tend to think of physical conditions as being the most disabling, right? But check this out, this data is stunning. On this scale, the disability weight of severe depression is actually considered higher than that of actively having a heart attack. It's a powerful, powerful reminder that this is one of the most debilitating conditions a human being can possibly go through. So why is depression so ridiculously hard to treat for so many people? Well, the problem isn't a lack of effort, it's a problem with the brain's fundamental wiring. Let's dig into the science here to see what's really going on under the hood. We're talking specifically about something called treatment-resistant depression, or TRD for short. Now, that's the clinical term for when a person's illness doesn't get better even after trying at least 2 different standard antidepressants. And this isn't some rare thing. It affects up to 30% of all people with depression. That's millions of people. For a long time, we heard that depression was all about a chemical imbalance, but the science is really pointing to a network problem now. Think of it like this. That area in green, the prefrontal cortex, that's your brain's executive control center, the CEO. It's supposed to be in charge of regulating the area in red, which is kind of like the emotion center. But in depression, the CEO becomes underactive. It gets sluggish, and the emotion center goes into overdrive, totally unregulated. That communication link is essentially broken. Now, for years, a treatment called TMS, that's transcranial magnetic stimulation, has tried to fix this circuit problem. But this shows a genuine quantum leap. On the left, you've got conventional TMS. It takes 6 weeks, it aims at a general area of the brain, and it helps about a third of patients into remission. But SAINT, on the right, it takes just 5 days, it uses a personalized target for each patient's brain, and in the initial studies, it hit a nearly 80% remission rate. That is just a night and day difference, a total game changer. So what in the world is the SAINT protocol, and what makes it so dramatically different? Let's break down the key innovations. The genius of SAINT really boils down to 3 things. It's faster, it's smarter, and it's stronger. Instead of taking weeks, the whole thing is packed into just 5 days. Instead of a one-size-fits-all target, it's smarter, using an MRI to find the absolute perfect spot for each individual brain. And yeah, it's stronger, delivering a much higher dose of magnetic pulses to really wake up that underactive control center. This is where that smarter part just blows my mind. On the left, you see the general theory of the circuits, but on the right, that's the SAINT protocol in action. They use an fMRI to create a personalized map of your brain. They find the exact spot in your prefrontal cortex that has the strongest possible connection to that overactive emotion circuit. It's like finding the one perfect light switch that can restore balance to the whole system. It's true precision medicine for the brain. And the faster and stronger parts? Well, they come together in this pretty intense schedule. Patients get 10 treatment sessions every single day for 5 days straight. Each of those sessions delivers 1,800 magnetic pulses. So get this, in just 1 day of SAINT, a patient gets the same number of pulses they would normally get in an entire week of conventional TMS. Okay, so this all sounds amazing on paper, right? Faster, smarter, stronger. But the real question, the only question that matters is, does it actually work when you put it to the ultimate scientific test? So, the researchers at Stanford set up a double-blind, randomized controlled trial. And this is the gold standard for a reason. It means neither the patients nor the doctors knew who was getting the real Saint treatment and who was getting a fake or sham treatment. There's no room for placebo or bias. This was the absolute moment of truth. The results were absolutely staggering. Of the patients who got the real Saint treatment, 78.6% were in remission after 5 days. Let that sink in. They were no longer clinically depressed. To go from severe treatment-resistant depression to remission in under a week, it's almost unheard of. And this chart from the study, man, it tells the whole story visually. Those black circles, that's the placebo group. You can see their depression scores stayed high and flat. But look at the white squares. That's the group that got the real deal. Their scores just plummet during those 5 days of treatment and stay low for weeks after. The visual evidence is it's undeniable. And, this wasn't just some statistical average where a few people got a little better. When you look at the data for each individual patient, the story gets even more powerful. On the left, in the active group, you see almost every single line taking a nosedive. These are individual lives being transformed. Now look at the right, the sham group. It's just a tangled mess. No consistent improvement at all. So what does a line plummeting on a chart actually feel like in real life? Let's go back to Tommy Van Brucklen, who was in the study. For him, it meant this. It meant rediscovering the simple joys that his depression had stolen from him for decades. Walking his dog, playing the guitar, not because he had to, but for the sheer joy of it. That is what remission looks like. The results are stunning, and the personal stories are incredibly powerful. So what does this all mean for the future? Could this be the beginning of a whole new era in how we treat mental illness? Well, it's already starting to happen. This isn't some far-off experimental thing anymore. In September 2022, based on how strong this data was, the FDA officially gave its clearance for this technology to be used. And that is the critical step to making it more widely available for the people who need it most. And one of the most incredible applications is in crisis care. Think about it. Standard antidepressants can take a month, sometimes more, to even start working. That is a dangerously long time for someone in a mental health emergency. Because Saint works in days, it could be used in hospitals to rapidly stabilize patients who are at the highest risk. And that could literally save lives. And that brings us to this final, really powerful question posed by the researchers themselves. For most of history, psychiatric treatments were basically discovered by accident. But Saint represents a huge shift. It's a treatment that was engineered from the ground up based on a deep understanding of brain circuits. It asks us to imagine a future where we don't just hope to stumble upon a cure, but where we can actually precisely design one.